Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Hi, I'm Dr. Kit Weathers, and once again it's time for the Root Tip of the Week. But before we get started, I want to show you something about magic tricks of the week. I've shown 65 different magic tricks since we started this segment, but what I'd like to talk about now is presentation and illusion. If you take something like this blue battery right here and you reach up and you grab it and you make it disappear, that's an okay trick, but it's over quickly and there's no real magic there. But if you say, I've got a battery and it's very highly charged, it's full of electricity, and what I'd like to do is grab this battery and then make it disappear by rubbing the little molecules together and it just goes away. Anytime you can tell a story and make it disappear, it's going to be more impressive. And I've got a story today to talk about Botox that I think will be very impressive to you. One more thing, let me just show you another magic trick. Let's say that you have somebody just pick a card at random, they reach in the deck and they pull out, say, 7 of hearts. If you put it back in the deck and shuffle it up and then you say, is that your card? Yeah, that's probably impressive, but it's not really as impressive if you do a better way to reveal it. Let's say you pick the wrong card on purpose. Is that your card? And they say, well, absolutely not. Well, keep a very close watch on it because maybe that's your card. Now that's a better way to reveal it. Oh, here's another one. Remember when we did the vanishing toothpick? And at the very end, I did a clincher by rubbing my fingers together to show that the toothpick was gone. It's all about sales. It's all about presentation as you talk about, you tell a story, all kinds of things to make it more personal and make it a better trick. You don't just say, your card was the 7 of hearts. You produce it in a very special way. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Okay, today's topic, the Root Tip of the Week, is Botox for dentists. Now remember, just as I made this battery disappear very quickly, what if I could make these lines disappear on your patient's face? Or the lines around a patient's mouth? What if you could smooth those out and make them go away instantly by just putting a little dermal filler in there? There is nobody more qualified to work on the muscles of the face and around the mouth than a dentist. And unfortunately, dentists are not permitted to do Botox or dermal filler injections in many states. And I want to show you some examples of what dentists are doing in the states where it's legal. And then I want to show you a link to my blog, which you can go in and put your opinion down whether or not you think this is a good idea. And what I'd really like for you to do is go to that blog and tell me in your state if it's legal or not legal, and post something that will actually document that. If there's a statement by the state board in your area, post that state board on the blog. Now, how do we get to that blog? Go to the link that's on the screen right now, and you'll have to copy that down if you did not come in directly as a member of our Root Tip of the Week. If you're a registered member of the Root Tip of the Week, you received an email from me, and all you have to do is click directly on the link that was in that email. The technique for administering Botox is actually very simple, as shown in the following demonstration.
We know that glabellar facial lines, the area between your eyebrows here, arise from the activity of the corrugator and orbicularis oculi muscles. These are the muscles that draw the eyebrows together in frown lines, wrinkle the brow, and are involved in squinting. When you frown, these muscles move the brow medially, and the procerus and depressor supercilii pull the brow inferiorly. This creates a frown or furrowed brow. Are you ready to begin, Jennifer?
Yes.
Good. Some patients may experience minimal and brief discomfort. The sensation is compared to a bug bite. We'll start by placing this cold pack on your forehead to numb the area. For many patients, a cold pack applied a couple minutes before injection provides a sufficient numbing effect. More sensitive patients may require a topical anesthetic. The location, size, and use of the muscles vary markedly among individuals. Lines induced by facial expression occur perpendicular to the direction of action of contracting facial muscles. An effective dose for facial lines is determined by gross observation of the patient's ability to activate the superficial muscles injected. Using a 30-gauge needle, inject a dose of 0.1 milliliter into each of 5 sites, 2 in each corrugator muscle and 1 in the procerus muscle for a total dose of 20 units. How are you doing, Jennifer?
I'm good.
You okay?
I'm good. Thank you.
How was that?
Fine, thank you.
Now that wasn't too bad, was it?
Not at all. Dr. Wu, when will I start to see results?
You should start to see results in 1 to 2 days, with the difference becoming very apparent by the end of the week.
And how long can I expect the results to last?
Well, it varies by patient, but generally results can last up to 4 months.
Thank you, Dr. Wu.
Thank you, Jennifer, and we'll see you at your next visit.
Dermal fillers are frequently used to smooth out glabellar lines, as we see in this side-by-side comparison, and dentists are the perfect healthcare practitioners to administer this material. Notice on the left you see the long needle that's being tinted up, and you can see a perfect outline of where it is. And on the right we see a much shorter needle. That's about a ½ inch needle where you have to make several penetrations to get all along that glabellar line. Much more difficult to do it this way. That's a plastic surgeon giving the injection of the material on the right-hand side, and on the left-hand side is a dentist using a long needle, which is very common for dentistry, and you can see the outline of it. And so far only 1 penetration has been made to get that entire line, whereas a series of 3 or 4 injections have to be made, as we see on the right-hand side. So this is one more reason that it's a good idea for a dentist to do that. The other big advantage to having a dentist do this is you can easily give an infraorbital injection or slightly below that and numb this area quite nicely. The patient on the right-hand side was not given any anesthetic to numb the area, so it's a more painful procedure in that particular case. This is a very simple procedure. It fills in the lines with the material, in this case on the left using Juvederm, and you see that the line is virtually gone. You get instant feedback. It's a very, very simple and very productive procedure. Well, I hope you've enjoyed this brief introduction to the injection of Botox and dermal fillers. It's a natural for every dentist to do this. Now, if you'll go to the American Academy of Facial Aesthetics, you can see the course that I took when I wanted to learn how to do Botox and dermal fillers. And in the future, we'll actually show you some of the cases that I've done. Now, be sure and go to my blog and tell me what you think about this. And if you have information that you'd like to add from your local dental societies, please let us know. In a couple of weeks, we will report back and give you an update. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp. So long for now.